Welcome to the 2026 Neuroendocrine Cancer Foundation's annual patient conference. Thank you for joining us today. I'm Kavya Velagapudi, Executive Director of the Neuroendocrine Cancer Foundation.
I'm Lisa Yen, Director of Programs and Outreach.
I'm Heather Davis, the Director of Community Engagement.
This year's theme, Navigating a Changing Neuroendocrine Cancer Landscape, reflects the rapid advances happening across diagnosis, imaging, treatments, clinical trials, and supportive care. We thank the sponsors of this event, Novartis, Exelixis, ITM, Lantheus, Crinetics, Curium, and RaceBio. Their support makes programs like this possible. The Neuroendocrine Cancer Foundation provides a community of support and education for people living with neuroendocrine cancer, as well as their caregivers. Our staff includes Lisa Yen and Heather Davis. Our board includes Donna Gavin, who is the sister of our founder, Giovanna Joyce Mbezi, and net patient and longtime advocate, Mary Donlevy. NCF is also guided by our Medical Advisory Council, made up of distinguished neuroendocrine cancer experts committed to improving patient outcomes. Neuroendocrine Cancer Foundation, previously known as LACNETS, is also the successor of the Carcinoid Cancer Foundation, which closed its operations recently. We have been entrusted to continue its programs, such as the Luncheon with the Experts, Support Line, Find a Doctor database, and Stories of Hope. Please visit our website for more information. And with that, I'll hand it over to Heather to continue today's program.
Thank you, Kavya, for that warm welcome and informative introduction. To ensure you don't miss our future educational events like today's, be sure to sign up for our email and newsletters on our homepage at ncf.net and add events at ncf.net to your safe sender and whitelist email lists. Follow us on social media. We are on Facebook, X, and Instagram with the handle at NCF Cancer. And now let's start with some tech tips. For audio, please make sure your sound and speaker icon is unmuted. Adjust the volume, control up or down to increase or lower the volume as needed. For video, if the screen looks blurry or hard to read, you can go to the gear or settings icon and click Quality to adjust the resolution. You may enlarge the webinar broadcast screen by clicking the full screen icon located in the bottom right-hand corner. Our YouTube channel now features 550 videos and podcasts. Click videos or playlists to find webinars on our previous annual conferences, various types of treatments, clinical trial snippets, and an array of patient and caregiver stories. Be sure to visit the valuable information and resources from our supporters on our virtual sponsor pages. Find information on treatments, clinical trials, and helpful patient and caregiver support resources from our partners. Go to ncf.net/events/2026 conference. I'd like to remind our audience that our webinars are created for educational purposes only and do not substitute for medical advice. The views shared in this conference are from the personal experts' opinions and insights. Please contact your medical team with questions or concerns about your individual care or medical treatment. And now I'll hand it over to Lisa.
Thank you, Heather. Today, you'll hear from an extraordinary panel of speakers, 18 physicians from leading institutions across North America, along with 5 individuals living with neuroendocrine cancer who will share their experiences and perspectives. Together, we hope to provide the knowledge, insights, and practical guidance needed to help you navigate a changing neuroendocrine cancer landscape. At the Neuroendocrine Cancer Foundation, we understand what it is like to navigate this disease. While much of today's program will focus on neuroendocrine cancer itself, we want to emphasize something equally important. You are more than your diagnosis. You are a whole person with relationships, goals, dreams, interests, and a life that extends far beyond cancer. Our mission is not only to help you understand and manage this disease, but also to support you in living as richly and fully as possible, even in the face of neuroendocrine cancer. I'm now going to welcome our moderators for today's conference. Welcome everyone to the Neuroendocrine Cancer Foundation's 2026 Virtual Annual Patient Conference. We're so grateful to have you joining us today. We're grateful to have NET expert Dr. Andrew Hendifar and NET patient Mary Donlevy return for their 6th year as co-moderators of our annual conference. Dr. Hendifar is a medical oncologist who leads the neuroendocrine cancer program at Cedars-Sinai Medical Center in Los Angeles, and he also serves on our medical advisory council. Mary Donlevy has been living with neuroendocrine cancer for more than 21 years, and she serves on the Neuroendocrine Cancer Foundation board. Thank you both for being here and helping to frame today's presentations with your valuable insights. This year's theme is Navigating a Changing Neuroendocrine Cancer Landscape. Over the past decade, we've seen tremendous changes in the understanding, diagnosis, imaging, and treatment of neuroendocrine cancer. And while this progress brings new hope and opportunities, it can also make the landscape feel increasingly complex and difficult to navigate. So today's conference is designed to help patients, caregivers, and advocates better understand this evolving landscape so they can feel more informed, empowered, and supported in making decisions along the way. Dr. Hendifar, I'm wondering from you, when you look at the neuroendocrine cancer field today compared to 10 to 15 years ago, what do you think has changed the most?
That's a great question. Things have dramatically changed over the last 15 years for our neuroendocrine tumor patients. I actually remember when the treatment team was just the patient, a surgeon, and a medical doctor to prescribe and to administer the SSA. And since that time, we've had several medications approved. We've had the development of new cytoreduction techniques. Liver-directed therapy has become more commonplace. Peptide receptor radiotherapy has been FDA approved, and now there are studies for newer types of radioligand treatments. And the neuroendocrine tumor team is just getting bigger and bigger. Right now on our tumor boards, we have doctors from surgery and different parts of surgery, hepatobiliary, lung, GI, intestinal. We have interventional radiology to do liver-directed, nuclear medicine getting involved with radioligand therapy, pathology, endocrinology to manage some of the symptoms, and cardiology to manage the carcinoma heart disease. So every few years, as we get better and better at this, our treatment team is growing and the landscape shifts.
Yeah, wow. That's really exciting to hear. It's not just the landscape of treatments that's growing, it's also the diversity in terms of providers that's growing the team as well. And Mary, from the patient perspective, progress can be both exciting and overwhelming. How do patients navigate a landscape that has become increasingly complex?
Yeah, I would say that there is no doubt that, especially for the newly diagnosed, this is a very overwhelming diagnosis. But also in other stages, down the road when you're looking at new treatments or even looking to consult with different teams of doctors. But the most exciting part is the hope that stems from the progress in the diagnostic tools and the treatment tools that Dr. Hendifar just mentioned. Just a few short years ago, so many of these were not available, like he said. And in my experience, in 2011 was the last time I had a liver surgery, and I was told by my surgeon back then that I was non-operable. But in 2023, I was able to have another liver resection due to surgical advancements, robotic, laparoscopic liver resection, which wasn't even considered for years prior to that. So this is just one example of, the advancements that have changed our landscape. And this isn't always the case with a lot of cancers and rare diseases. So we're very lucky to have the incredible people working for us to get us to this point.
Yeah, amen to that. We're very fortunate and grateful. Dr. Hendifar, I want to follow up on what you mentioned. Patients today are hearing those terms and concepts, many of which you just touched on, that may not have even existed when they were first diagnosed. So molecular imaging, theranostics, SSA, somatostatin analogs, radioligand therapy or PRRT, treatment sequencing, tumor boards, multidisciplinary. What do you think patients need to understand the most about how the field has evolved?
Yeah, another great question. As the field has grown, as our understanding has improved and the options have expanded and the treatment teams enlarged, treating this disease has become actually more complicated. And I think it's become more important than ever that you have a neuroendocrine tumor expert on your team. Many of our patients live very, very far away from an expert center, and that's okay. They only have to meet up with the expert maybe once in a while, once a year or so, just to review everything and to help organize the case, help organize the thinking. And I think more than ever, it's becoming important. Unfortunately, our general medical oncologists have to take care of all types of different cancers, and neuroendocrine tumors are quite rare, and they might only be taking care of 2 or 3 patients at a given time. So I think it's great, the developments and the new treatments, but again, it's always important to have a neuroendocrine tumor specialist on your team.
Yeah, highlighting the importance of seeing someone who sees a lot of neuroendocrine cancer. Mary, for someone who is newly diagnosed and suddenly entering this world, what advice would you give them about navigating all of this information without becoming too overwhelmed?
Yeah, I will say that the overwhelm part, like I discussed earlier, especially at the beginning, is really normal. So just kind of settling in with that. But one of the best ways you can put your mind at ease is what Dr. Hendifar just said, is making sure that you do have a neuroendocrine specialist team that you're working with, because they're going to be able to explain that what is applies with other cancers may not apply with our cancer. It's often slower growing, and even hearing terms like stage 4, they don't carry the same meaning and the outcomes with neuroendocrine. So it's really important that you're with a specialist that can really share these important pieces with you. And then additionally, is your quality of life is definitely impacted by cancer. There's no doubt about that. But you can really impact the emotional side of the quality of life if you do have a team that you feel supported by, and family that can support you, and a support group where you're actually getting to talk to patients that are also living with the same cancer, so you don't feel alone. So all of these things I think are really important to feel supported. And we're going to talk about supportive oncology and palliative care in a moment, but I think that's also a really important piece of the puzzle.
Yeah, it's more than just treatment. It's the whole person that matters. Yeah. Well, we're going to introduce our first set of speakers. Dr. Hendifar, take it away.
Thank you. Our first presentation is Navigating an Understanding of Neuroendocrine Cancer. What should I know about my cancer? Which is presented by Dr. Udvair Graywall, a medical oncologist at Emory Winship Cancer Institute in Atlanta, Georgia. Following that, we'll hear Navigating Scans from Dr. Delphine Chen, nuclear medicine, physician and scientist, professor of radiology, and director of molecular imaging and therapy at Fred Hutch Cancer Center in Seattle, Washington.
Next, we'll transition into our first panel discussion, Navigating Supportive Care. This panel will be moderated by Dr. Dang Lee, a medical oncologist and director of the Neuroendocrine program at the City of Hope in Duarte. And he will be joined by Dr. Banerjee, who is a palliative care physician and leader in supportive care at City of Hope, as well as Sheila Lindsay, neuroendocrine nurse practitioner at UCSF. And lastly, Victoria Ramirez, who's a licensed clinical social worker in palliative care, previously at the City of Hope and is now at USC. And this conversation will explore the many dimensions of supportive care and quality of life for those living with neuroendocrine cancer.